Blume edit. The Blume edit. The Blume edit. The Blume edit. The Blume edit.
You're listening to The Blume Edit, where we talk all things beauty, business, and being unfiltered. I'm your host, Kia from Blume Aesthetics. Welcome back to The Blume Edit. I'm Kia from Blume Aesthetics, and today we're in great company. Our guest is not just one of Perth's most trusted cosmetic nurse specialists, but also the heart and founder behind One Clinic. With over 14 years in the industry, from aesthetic training to running her own clinic, Jamie Lee brings both technical depth and a sincere commitment to client care. Welcome, Jamie Lee.
Thank you for inviting me.
Thank you for being here. And you were saying before this is your first podcast.
It is, yes. So let's hope it goes okay.
You'll be fine. You'll be fine. It's just us having a chat. It's nice to talk to someone else in the industry and get some different points of view and someone who's way more experienced than me. Oh. Well, let's start at the beginning. So you've got such a rich background from nursing to advanced aesthetics to teaching. What originally drew you into this field?
So I started off in beauty and dermal therapy, actually. So I've always loved the skin. I've always loved the face. And I started off working in a cosmetic clinic that was run by an amazing cosmetic doctor. I did all the skin treatments, the machinery, really consolidated all my skin health and anatomy knowledge and treatment planning there. And I would help consult her with the cosmetic treatments. So we used to cross-refer, we'd go in consultation together, and I just loved the thought of doing the injectables myself. I had all that background training. It was really different. A very long time ago, the reps would come in and train all the dermal therapists as well, so we could help cross-refer. So off to uni I went, and so she supported me through my degree, mentored me for a number of years, and it was really great. I just loved it.
So you went to uni for nursing to become a cosmetic nurse?
Yep.
Yeah, wow.
Yeah, and I didn't expect it, but I loved traditional nursing. So I did acute medical nursing, cardiac nursing, perioperative nursing for 10 years. I dual nursed and injected at the same time. So very busy, lots of shift work, but yeah, it was all worth it. I was really lucky. The hospital wards that I worked on, they accommodated my set shifts, so I could do my lists with my patients. So I'm not sure how they were all patients. Maybe that's it. They all let me get away with that, so that was good.
Do you find that pretty important to have a bit of acute, not necessarily hospital experience, but acute nursing experience to come into this industry?
Definitely, because people faint, and you look at their medication and their medical history on their forms, you really need to know what that is for. So many times I've taught new injectors and they don't have that clinical background, and they have to look up what those medicines do, because we do need to be looking out for any contraindications, any autoimmune disorders, important things like that. And normally it will be the medicines that trigger those questions, those further questions you have for the patient. So you do need to know clinically what those mean, but also if something happens, how to control yourself in an emergency situation. You learn that in the hospital through your MET calls or your patients that are critically unwell, how to maintain that composure and not freak out, basically.
I think people underestimate the cosmetic industry as nurses. There's actually certain disorders or diseases that if you get certain treatments, you can die. There's actually, it can, paralyze your airway. You then lose consciousness. So it is actually something to have those skills, like you said, because we are looking after people's, faces, their outcomes, but also their lives. You're a nurse,
Yep.
I think it's important. You've built One Clinic into a standout brand, clinical, high-end, but deeply personal. What was your vision when launching it, and how has it evolved?
So it's evolved quite a lot. I was working FIFO at the time, so I was working Monday to Friday. I was a national trainer for one of the pharmaceutical companies, so I wanted to keep my clinical skills up. It really wasn't worth me working for somebody else just for 1 or 2 days a week, and I needed that flexibility because I'd have to fly over the country, I'd have to go to conferences and things like that. So I opened up my own little space, tiny little room, I had nurses work in the week, and then I worked on the weekends when I wasn't teaching. It evolved quite quickly. We had to move to a bigger space in Kingsley, so we've been there for 3 years. And then about 18 months ago, I made the big decision to leave that job and then work full-time and open up my training academy in Butler. So it's ever-evolving. Kingsley, we've grown out of a second time, and so we've just fit out a bigger premise there. So we've set now with our 2 clinics, that's enough. But the vision's always been the same. And the reason we're in those really little suburbs and not central or in the city is we're trying to bring a luxury experience that's affordable to our patients. So we kind of wanted the best of both worlds, and just to bring it to everyday people. That was the main vision.
All right, let's talk skin. So at Blume, we're passionate about regenerative beauty and working with the skin, not against it. What's one myth about skin health or collagen that you wish your clients understood better?
Sure. So the biggest myth, I think, with collagen in particular, or building collagen, is that it's not a quick fix. So we start depleting our collagen in our mid-20s. Our lifestyle choices affect it, what we eat, drink, exercise, sun exposure, many different things in our lifestyle. So if we're trying to rebuild that damage, it's going to take more than one session. So drinking a collagen powder doesn't go straight to your face. Multiple treatments are needed. So that's, I think, a bit of a myth when someone's selling a collagen treatment. It's more than that.
And that comes with experience in enabling the patient to become educated in that process and to, sell them on that financially as well, because it's not, collagen journeys are not, like you said, a once-off, so it can be expensive. It's long-term. That's something quite challenging for you, or do you find it you can educate your clients enough that they respect that?
I think we don't have any issues in our clinic because we are very formal with our consultation process, and we explain the science or kind of what's happening. So even if the patient comes in with a muscle-related query and we can see some changes in the skin, we're going to explain that different types of treatments are going to be needed to accommodate for the different types of changes that are happening within their anatomy and the different layers and what happens as we age. A lot of people don't know this about themselves or the anatomy. They're surprised that you have multiple muscles in the face that can move the skin, and the reason they're getting wrinkles is because the actual collagen is breaking down and it's losing its strength. So it's all about consultation. Yeah.
And I think we're lucky in that social media these days actually is slightly educating, or at least bringing people aware of that now. So they'll come in and they'll say, I saw this reel, or I saw this thing on TikTok about I started my collagen production slowed down in my 20s. I'm now in my 30s. Like, do I need something? And you're like, well, So I think in a way social media helps bring awareness in that, and we can then consolidate that in your consults.
Yeah.
So you've trained hundreds of practitioners through one clinic's academy, including me. What's the biggest mistake you see new injectors make, and what's your advice to them?
Sure. So for my newbies, something I've really encouraged them to do is to try not run before they can walk. So that's my biggest advice. I'm like, just master each indication as you go and get good at that one, and then move on to the next one, because you don't want to be a jack of all trades, master of none. Just make sure you consolidate every little step along the way, and then you will be, proficient at everything.
Do you find certain areas of the face more difficult than others? So you would prioritise for a beginner, they start on certain areas, and then more intermediate and advanced different areas?
Yeah, definitely. So they're all sectioned in that way. We look at how long they've been injecting for and what they're doing already. Crazy in the section of novice injector is, perioral area, lip volumization. And if we think of the anatomy and the vessels, it's wild that we start there. So normally we'll section it up in different parts of the face to, I suppose, how hard they are to do and what the person's doing already.
You teach injectors across Australia. What are 3 non-negotiables you always drill into your students?
Safety, definitely, number one. They need to know their anatomy. They need to be doing slow, steady, careful injection techniques. Then also ethics, so never providing a treatment for someone that doesn't need that really, or it's not going to be best for them, and learning how to say no and things like that is really important, but also why. And also compliance. So compliance is really important, especially in our industry. You really need to make sure that you're doing everything correctly, making sure all your T's are crossed and your I's are dotted, prescriptions, making sure you got all the licenses, everything that you are required to have in place before opening a business or, working under somebody.
And it's an area that we have to stay so current and educated on because our regulations are changing. So to be compliant can look one way one week and completely different the next week. So is that something you tell them, just keep, updating yourself? Because it keeps changing.
Yes.
Unfortunately for us. And so what makes your training different to other training courses?
So my training is more a mentorship rather than a course. And we also just do 101 or 1 and 2 training. So it's a really private, personal training session where it's me, the HCP, and many models in a day. So it's very hands-on and you get to do the whole model. So a lot of the training courses are multiple HCPs in a room and they're sharing a model, and they might be able to do maybe a quarter or half of, a lip or one piece of anatomy. So I've focused this really, really in-depth, hands-on. I'm literally with them doing, up to 10 models in a whole day. It's really quite full on. But that rote learning really helps them. And it's also broken up into indications. So we will do a certain topic per day, and then that way they're getting a lot of exposure per topic. And that really helps just get them to be able to choose the correct products for the right indications, for the right tissue type, facial consultation on every single one of them, because all patients are different. So 1 or 2 models is just not enough.
And as a nurse, it's something that we don't obviously get exposed to in university, hospital. It's completely different. So stepping into this field is pretty daunting. Like, you need someone, like you said, right next to you, supportive. We can know the anatomy, we can know things like that, but the products are something we've never seen before. The patient's concerns are something we've never really thought, nothing to do with health, Yeah. So I know that's something for me. See one, do one. Like, that's something that I kind of value, in that I would watch you do something, I'll be like, yeah, I need to do, like, I've got a bit more confidence now,
Yeah, that one-on-one attention is really important. And the scariest thing is we learn on real people. You've never put a needle in somebody and then we're like, all right, off you go. It's really quite daunting. So if I'm there quite literally holding your hands, it's quite helpful.
You've worked in both cosmetic and medical environments. How do you think the aesthetics industry is evolving and what needs to change?
I could talk about this all day, definitely. The aesthetic industry it's evolving so very quickly, and there's been a huge influx of nurses and doctors wanting to do injectables, and with the evolution of telehealth, it does allow practices like myself and yours to run our own independent clinics, which is really great. But I do think there needs to be a little bit more structure involved. If I could wave a magic wand, I would probably get rid of some of the scrutiny that we are constantly under. It feels a little bit like we're all getting thrown into the same category or box of being a little bit like a cowboy, or at the moment, everything seems a little bit accusative from a regulatory standard. And that's why we're seeing these big waves of almost clutching at trying to regulate us or without the full information,
Like
or maybe
knee-jerk, sort
it's
of
a little
knee-jerk reactions.
100%. So I think a little bit more collaboration would be really good, to speak to practitioners that are on the ground and running their businesses, and help with those regulatory bodies to put something in that works and that people are going to comply, and actually make them comply by it, because some people do and some people don't, and that makes it a little bit frustrating or grey with that. With these waves of changes, we're seeing before and after photos get removed, no price lists. I can see why they're trying to do it. I understand they're trying to make people not be sold to or anything like that, but they could probably change it and do it a little bit different. So instead of having no before and afters, just make sure that the before and after of that person is not edited and, sensationalized and, put fancy words on it, anything like that. Because patients are losing their education. So I'm finding more than ever patients are coming in with different expectations altogether, because they have no idea what the reality of a treatment looks like. So they're either really scared, or they think that, a little bit of product is going to give them these incredible results, because they've got nothing to refer to.
Yeah.
They also can't pick their practitioner. So like, I will inject different to another person. I'm quite modest, and maybe another practitioner really likes large augmentation, and there is a place for everybody. But the patients can't see what kind of practitioner you are until they're in there, and it's too late, really, because there's no way of seeing what your style is as a practitioner. Same thing with price lists getting removed. I certainly think the patients should be educated and have an idea of what something might cost before they come in, just to save them maybe even the embarrassment of saying they can't afford it. That's something that worries me. Or also, you might have two places that have the same ethics and they can give the same results, and one will charge a wildly larger amount, and the patients won't know because they can't see a price list before going in. And especially for clinics that charge for consultations and then waive the fee if they get a treatment done, that patient's locked in, and they don't know that they could probably get something a little bit more in their budget. So I think the choice is getting removed. So there's some things with these waves I'm like, could probably tweak them a little bit. But also, I would really love to see aesthetics become a specialty. Like, we need to now start, it's getting so big, we need to be seen as its own field of medicine. And for doctors and nurses both, if that is the case, we need to have an accredited training qualification, because I think if the regulatory bodies are worried about the quality of injector that's coming through, so they're trying to block us from evolving and scare people not to open up their own businesses because it's just so hard now, put something in that makes sure that they know what they're doing before they do it. That's something I would really love to see. I think that would help bring up the quality and maybe lessen the quantity of people that are entering aesthetics. Might be helpful.
So you kind of touched on this before, but you do say no to clients, you do refuse treatments. How do you handle that conversation with empathy and sort of with a, option or a path for them, especially when there's, that growing demand for natural but polished results?
I think something I've learnt over the years is the patients actually don't get mad when you say no. You have this fear that you're going to disappoint them when you're like, I don't think it's a good idea. But once again, education is key. So sometimes my patients even come in knowing, my long-term patients, that I might say no to them. They're not ready to have another treatment done, and we might come up with a different focus. So instead of just being like, no, I'll tell them why. What is the clinical reason of why I'm saying no? Is it because they might look a certain way and I know they're not trying to achieve that? Or is there a safety risk or whatever it might be? I'll give them the reason why, and they seem to understand that quite well. Or I'll try and figure out what it is that they're finding that is an imbalance because sometimes they might only know about a certain treatment and they'll just go for that one thing over and over again. So it is up to us to do a proper full face assessment and figure out, is there something unbalanced there that they can't quite put their finger on it, but we should be able to help them work it out that way.
That comes from experience, I find. Like, as my years have gone by, you get, number one, the confidence to say no, or at least the confidence to say not that, but this. I think this is going to be better for you, because that comes with then recommendations. You know, if they come in, I want this, it's like, that's easy to say, yeah, sure, like, let's do that. It's so much harder to be like you said, that your concern, I get your concern, but that's not going to fix that. This is what we need to do.
Yep.
Yeah. How do you manage client expectations while still staying true to ethical, high standard practice?
It's all in the consultation. It's all about patient education, really taking the time to go through the whole process with them and making sure they understand why they're having these signs of ageing and what you can offer them to help their concerns, and different levels as well. So we're going to go from skincare to skin treatments to injectable treatments. We give them multiple options, so they don't always just have to go for the hardcore. If they're not into that, we can slowly help them, and very often they need all of them anyway.
Do you ever recommend like a surgical approach? Do you sort of say, look, we're at this stage now where maybe we need something slightly more invasive?
Yeah, so Dr. Rob Choa, if you're listening, you get a lot from me. For sure. So definitely. I'm so honest. I'm like, this is a surgical situation. If you're pulling up your face or you are like, can I get a brow lift? I'm like, no.
And I think we're lucky in that it's actually, living in a society now where that is actually pretty acceptable to have plastic surgery, to have cosmetic surgery. So to recommend that to someone, you know, maybe 5-10 years ago, people would be like, oh my God, I would never do that. Whereas now people are like, oh yeah, I was thinking that, you know, do you know anyone?
And I just be honest with them. I'm like, I would love to take your money, but I don't work like that. So there's nothing I can do that will give you the satisfaction that you require to achieve those results. So I would just be wasting your time and money. This is what I suggest.
And that's about patient expectation. Yeah. Like, you know, saying no is so much harder than saying yes, but you're not going to achieve their expectations if you keep saying yes and, you know, going around circles, you know. So as a business owner, educator, clinician, this is always a question that's difficult for me. How do you manage burnout and decision fatigue, especially when so much of your role is giving to others?
I won't hide it. My life is absolute chaos. I'm a mum of 2, husband, 2 businesses, 12 staff. It's full on. It's full on all the time. But we have worked very hard to delegate and have people in positions that can take some of those, work off me. So my staff are incredible. I have the most wonderful staff. They work really autonomously. They make good choices or decisions within boundaries. My clinic manager just has everything running so smooth because I just run around like a headless chook all the time. My husband's a businessman, so he does all the back end things, all the finances and the balancing that way. I'm more clinical. So it really is teamwork and then, that delegation. But also, making sure your business is set up so it can run without you if you do need to have a step back and take that time out.
That seems to be a bit of a trend. I think that's actually, when I got asked that question, that was the exact same thing that I said. I said delegation. It's not a sign of weakness. It's not a sign of you palming things off. It's actually a really wise decision, and it shows growth that you can let go of that, you know, to bring in someone that's probably not better at it, but can actually do it just as good as you, and you don't then have to spend your time and effort there. And then also a really supportive husband to help, because I'm the same. My husband does half of the business stuff and he has his own job as well. So
I often forget that my husband has a whole company of his own. And everyone that follows my social media, he does all the fit outs as well for the clinics.
Same.
And they love watching me punish him on Instagram and make him build all the cupboards and do all the stuff. And he works in IT, so he does pretty good.
Does he enjoy it?
No.
Yeah. I've never asked my husband, but he doesn't get a choice.
No.
So. Well, at Blume, we're also big believers in beauty rituals that go beyond treatments. So what's something that you do for yourself regularly that fills your cup?
People wouldn't expect this of me, but I'm actually like a massive camping girl. So really often we will pack the kids up and just go up north or down south, wherever the beach is. I just brought the fanciest caravan, so I do it fancy. In the sun, no internet, minimal contact is just a really great reset. So
In the sun wearing your SPF.
of course, I mean, yeah.
Yeah, that sounds nice.
Yeah.
Well, Jamie Lee, thank you so much for being so open, generous and real with us today. Your dedication to clinical excellence, your ability to lead with both heart and skill, and your vision for the future of aesthetics is exactly why we started this podcast in the first place. We hope today's episode gave our listeners a deeper understanding of what's really involved behind the scenes of this industry, the risks, the rewards, and the responsibility. Whether you're a practitioner, a client, or someone curious about how the industry is evolving, we hope you walk away from this episode feeling more informed and more empowered. We'll see you all next week for another episode of The Blume Edit. This is The Blume Edit, unfiltered, unscripted, and unapologetic. Subscribe now and tune in weekly.